Today's topic is, what is the difference between IVF and IUI? The quick answer is that IUI places washed sperm directly into the uterus during ovulation. In IVF, we actually retrieve eggs from the ovaries and fertilize them in the lab, and then transfer resulting embryos back into the uterus. Generally, IUI is less invasive and more affordable, while IVF offers higher per cycle success rates for more complex fertility challenges. Markham Fertility Centre offers both IUI and IVF across 5 locations in Ontario, with funding available through the Ontario Fertility Program. Welcome. I'm Dr. Marta Wise, and I'm a fertility physician here at Markham Fertility Centre in Markham, Ontario, Canada, and co-host of My Fertility Podcast. If you're here, you're likely navigating questions about your fertility, and you are not alone. My goal is to help you understand your options so you can move forward with clarity and hope. So how does each treatment work? IUI, or intrauterine insemination, involves the collection of a semen sample that is then washed to isolate the most motile sperm, or the best swimmers essentially. This concentrated sperm is then deposited directly into the uterus with the use of a thin catheter during a speculum exam performed by one of our physicians. Fertilization, meaning the egg and sperm meeting, happens inside the body, in the fallopian tubes. The procedure itself takes only a few minutes and requires no sedation and feels very similar to having a pap test or pap smear. With IVF, or in vitro fertilization, injectable hormones are used to stimulate the ovaries to produce multiple eggs over about 10 to 14 days. Eggs are then retrieved through a short outpatient procedure that is done under sedation. The eggs and the sperm are then combined together in the laboratory, either via conventional IVF or ICSI or ICSI, where a single sperm is injected into each egg. Resulting embryos will then develop over the course of 3 to 5 days before potentially being transferred into the uterus or frozen for future use. The core difference with IUI is that fertilization occurs inside the body. In the world of IVF, it occurs outside the body in a controlled lab environment. Now let's do a side-by-side comparison of IUI and IVF. Please see the chart on the screen for full details. We're going to cover a couple of the factors though. With IUI, we cannot do genetic testing of the embryo specifically or pre-implantation genetic testing. However, this is available in the world of IVF before an embryo transfer. As well, there's a large cost difference between performing IUI or a cycle of IVF. And again, with the Ontario Fertility Program funding, you can do an unlimited number of funded IUI cycles over a lifetime, while there's only one government-funded IVF cycle available in somebody's lifetime. Let's talk about success rates by age, specifically the age of the person who is providing the egg. See the table on the screen for full details. But briefly, it's important to note that in people under the age of 35, the chance of pregnancy in a cycle by IUI is about 10 to 20%. In IVF, that pregnancy rate is about 50%, so it's much higher in the world of IVF. Once we get to about age 40, the chance of pregnancy by IUI is about 5 to 10%. In the world of IVF, the chance of a live birth is about 20%. Here are some key takeaways. IVF consistently delivers higher per cycle success rates across all age groups. IUI success drops significantly after the age of 40 for the person who is providing the egg, making IVF a stronger and better option for older patients. IVF also allows for pre-implantation genetic testing of the embryo, or PGT, which can further improve outcomes by selecting chromosomally normal embryos, or euploid embryos. Most IUI pregnancies will occur within about 3 to 5 cycles. If somebody is unsuccessful after that, the transition to IVF is typically recommended. So when is IUI the right starting point? IUI, or intrauterine insemination, is generally recommended as a first-line treatment when infertility is unexplained and both fallopian tubes have been shown to be open, or if there is mild male factor infertility, meaning that there is a slightly low count or decreased motility of the sperm. IUI is also generally recommended as first-line treatment if the patient has ovulatory disorders such as PMOS, or polyendocrine metabolic ovarian syndrome, that was previously known as PCOS. IUI is also a first-line treatment for same-sex female couples or single individuals who are using donor sperm. IUI is a first-line treatment when cost and invasiveness are primary concerns. In general, IUI is more affordable, requires fewer medications and less injections, and involves no surgical procedure and is publicly funded in Ontario. Where Ontario limits IVF funding to 1 cycle per lifetime, there is no lifetime limit on funded IUI cycles. So when is IVF the better option? IVF may be recommended from the start or after failed IUI cycles, when one or both fallopian tubes are blocked or damaged, or if there is severe male factor infertility that requires the use of ICSI or ICSI, or intracytoplasmic sperm injection. IVF may be recommended when the patient who is providing the egg is over the age of 38 and time is a critical factor. IVF may also be recommended after about 3 to 5 IUI cycles that have not resulted in a pregnancy. IVF is also recommended as a first-line treatment when genetic testing or genetic screening of embryos, meaning PGT, is needed or recommended. IVF may also sometimes be used as a first-line treatment when there is moderate to severe endometriosis or where fertility preservation is part of the plan, meaning that somebody is wanting to freeze eggs or to freeze embryos for future use. Again, IVF works around more fertility-causing issues than IUI and often offers a faster path to pregnancy due to higher per-cycle success rates. So how do the costs compare in Ontario between IUI and IVF? Please see the screen for the full details. Ontario residents do benefit from one of the most comprehensive fertility funding programs in Canada, through the Ontario Fertility Program, or OFP. Generally speaking, for IUI, typical out-of-pocket cycle costs would be about $700 to $2,600 for IUI. For IVF, out-of-pocket costs can be anywhere from about $5,000 to $16,000 plus. Ontario also has a fertility treatment tax credit effective as of January 2025 that allows residents to claim 25% of eligible fertility expenses up to about $5,000 per year. This applies to both IUI and IVF costs, including medications, diagnostic tests, and treatment-related travel. So how does Markham Fertility Centre support both treatments? Markham Fertility Centre has helped over 13,000 families since 1990 and is approved under the Ontario Fertility Program for both funded IUI and funded IVF. We have 5 locations across Ontario in Markham, Barrie-Innisfil, Oshawa, Orillia, and Sudbury for convenient monitoring. We offer pain-free egg retrievals with an anesthesiologist present at every single egg retrieval, and we are the only clinic in Ontario to do this. We have an on-site full genetics team for PGT counseling and embryo screening. We also offer comprehensive 2S LGBTQIA+ family planning and Health Canada approved donor and surrogacy program. We also have a specialized dispensary for fertility medications at the clinic. Your fertility physician and you will help determine whether IUI or IVF is the right starting point based on your age, your diagnosis, timeline, and family planning goals. And that concludes our video on the comparison between IUI and IVF as fertility treatments. Again, I'm Dr. Wise, a fertility physician here at Markham Fertility Centre and co-host of my fertility podcast. I want to leave you with this. Even in moments of uncertainty, I hope you can find space for kindness towards yourself and trust that there are still many options and roads ahead. Until our next video, where we deconstruct more topics in the world of infertility. Make sure to follow along our Markham Fertility Centre YouTube channel.